alive today, the second day for launch. The gap was born yesterday. And this is in a very good situation right now. We are number one best selling in four categories actually. And in Canada, we've been in number one best selling the first day, like after 1 hour launching, we've been there. So we are in a very good position. And I'm so happy to have Reed Davis and Dr. Jordanna Quinn today. We're going to go through their chapter and talk about regenerative medicine and functional medicine together. Be with us till the end. Personally, I love both of you. And thank you so much for all of your support to be in this book. It's my honor to have you. And my purpose as you is to introduce holistic medicine. Why I'm saying holistic medicine? Because it's not enough to diagnose something and then you just go for the treatment. And accidentally, we have three doctors for regenerative medicine in this book. And it's great because now we can compare regenerative medicine and functional medicine. Why we are going to talk about this today. First of all, thank you so much, Reed. Can you just introduce yourself? Well,
Yeah, thank you so much, Pante. It's been a real pleasure and an honor to be involved in your book, The Gap, along with Dr. Quinn and all the other co-authors. I have uh, people probably know been doing the health business for 22 years. I started off in a clinic, and after about 10 years of really good research, just really in the trenches, I was running thousands of and I discovered some patterns, which we've included in the book, things that I recognized, along with the very good mentoring, of course. But I recognized my own patterns and um, figured out a way to investigate the underlying causes and conditions in chronic stress related conditions. So my background is just experiential. I was in the trenches working in a clinic, thousands of labs, thousands of people, recognized some patterns. And then after about 10 years, I realized I could reach a lot more people if I would teach others, kind of deputize them to do the great work that we do. I called it functional diagnostic nutrition, and the rest is kind of history. Teaching the course, we have thousands of practitioners. We're in 50 different countries, and we're doing some amazing work. And thank you for allowing me to take part in this great book.
thank you so much, Reed. And I'm really honored because you actually opened my eyes to functional medicine, and I studied functional medicine, and I love it. So far, I'm loving it. And we have Jordana Quinn here. Thanks again. We missed both of you yesterday on the call, but I said I'm going to have them because they have very great message in this book, and especially about this connection between regenerative medicine and functional medicine. I really wish to know why we have these both together. So, can you introduce yourself, Queen
Yeah.
Jordana?
So I am a doctor of osteopathy. I trained, I guess, in the traditional model. And I've always been more holistically medicine minded, which is why I went to osteopathic medical school instead of traditional medical school. Um, but I made the decision to still do medical school because I do believe in the medical model. It just focuses in, it's not the best for chronic disease. It's kind of what you learn over the time, but it's great. If you break your arm, you should cast it. You shouldn't just let it fly into the wind or, whatever. So I have been an athlete my whole life, and we were raised with not a lot of money. So we never like had health insurance and didn't go to the doctor, and we ate all natural and healthy, and my mom just kind of raised me that way. So I want to say functional medicine is innate within me just because of the way I was raised. However, After going through medical school, I am board certified in physical medicine and rehab, which is the study of anything that makes you not move normally. So it's more outside function than inside function. So sports medicine, brain injuries, spinal cord injuries, neurologic conditions, rheumatologic conditions, anything that makes you not move normally is my training. Um, and so my first couple years in practice, I was in a very traditional pain management, sports medicine practice, and just honestly begging people to take care of themselves, mostly pain management. And I felt, I mean, I would talk to people till I was blue in the face about, um, nutrition, because and I read these books for fun. And so after a couple years in practice, just thinking like, oh my gosh, I'm like a nerd and reading nutrition books for fun. I should practice this type of medicine. And kind of just to really summarize a story, as I reached out to a doc in town who I knew did some more kind of, he's an anti-aging medicine physician, told him he should hire me for regenerative medicine. He did. And then he opened my eyes to the whole world of functional medicine that I didn't even know existed. And when I joined that practice, I literally felt like I was at home. I was like, this is why I went to medical school, not to prescribe. And I think there's a time and a place for prescriptions, but really focusing on health, right? I mean, I think all physicians truly want people to be healthy and live their best lives. We just don't, in the regular traditional medicine model, have the time and the resources to do so. So when I started working with him, I mean, literally, I just felt like this is what I'm meant to do in medicine. And so going back to the regenerative medicine component, I mean, that makes sense to me just for my training. I started off in the regenerative medicine space, just in the orthopedic space for joints and tendons, and using your body's own natural healing process and concentrating them down to a super therapeutic dose and injecting them back into areas of injury to prevent surgery, is, in my opinion, super cool. I love doing it every time, because I mean, you can see changes on MRIs, and you can see changes, not only do patients physically feel better, and I get athletes back to doing their sports that they either never thought they'd be able to do, or thought they'd never run again, or need a knee replacement. You could see changes on MRI. So that's awesome. And then it makes sense. The body in medicine, we go to residency and we learn cardiology, or we learn nephrology, or we learn dermatology, but you cannot, so we separate it, but truly from our head down to our toes, we are all connected, and you can't, so we try to separate it, but unless you're addressing all of it, which, all of it, it's impossible as a physician in an hour or 30 minutes to address all of it, but it all relates. And so back to what Reed Davis was talking about, you could get the labs. You kind of touched on this. You can get the labs and you can get the things, but really when you see patients and where they're coming to you at that moment in their life, even in their mental state, affects their physiology. And so again, we're trying to separate them, but they're inseparable, really, if we want to truly affect health in people. So that's kind of my jump to functional medicine also, is just, I don't know. I tried to specialize, but then I realized oh my gosh, it's all, you can't just do this without, if you really want to affect change in a patient, you got to focus
You
on
have to look at this holistically. Exactly.
Yeah.
That's the purpose of this book. First of all, I just want to support all the medical doctors, because I have my medical doctors as author in this book. And also want to say, healing is not only the physical body, and you need to have your mind and spirit connected to your body, and is not only one part of your body, as Reed says. And I'm learning more and more every day. And these functional labs, Reed, are amazing. Like before, when I had my fertility journey, I said, I, I wish I could have done that those days. And I missed it, because I was like, these missing puzzles, especially when you have estrogen dominancy and you don't know. They just give you the progesterone because you have low in progesterone as well. And then that's the whole story in fertility uh, treatment. And unfortunately, there are a lot of expenses you pay to IVF and IUI without just going through all the missing pieces. And I'm not denying IUI or IVF or all of this treatment are great, but if your body is not ready, you cannot do it, right? And
Yes.
yeah, that's the whole point.
If you're
Well,
physical and you're mental, right? I mean, we see it all the time in medicine of people who can't get pregnant for whatever reason, because they're trying. I mean, it's not, and then they just stop trying and assume they're not going to get pregnant, and then they get pregnant. And so there is something that is ineffable that happens with people with the psychological component of now we're
Exactly.
not trying and I get pregnant. Like, because your physiology your physiology clearly changed, but we just don't know what that change was to allow it to happen, which happens all the time. It's so interesting.
yeah, we've seen it many times. So I think you're addressing the underlying causes and conditions, which you have to also realize that they're having an effect upon each other. So what we noticed from our lab work, and especially in cases where clients of ours have been to a practitioner and been told nothing's wrong with you. So your ordinary blood work just looks, everything seems to be within range, one end or the other, but nothing's grossly out of range. So physicians may not have an answer for that. You're sort of not bad enough yet. You're not medical yet, which is why we call our program non-medical. And some people might need both, the medical, obviously, with what Dr. Quinn does especially. And I have a real affinity for it, by the way, because I have what you would call a very well-used body. And so I've been through all the sports and motorcycle, these kind of injuries and things. I've gone all the way up to stem cells. That's a medical treatment, which my old body needs. But there's also a lot of other things it needs. And that's where my practice comes in, and what I teach. We do look at lab work, but we're not looking to diagnose and treat. We're looking for simply healing opportunities. So getting back to what Panteas said, these healing opportunities could be within the hormones, the immune system, digestion, detoxification, and others. And so they're way upstream from where the symptoms are actually occurring. And by the way, they're having an effect upon each other. And they're not singly measurable, some of these things. So we look at a broad number of, again, these healing opportunities. I look at it like a constellation up in the sky, and you need enough of the constellation to be able to recognize what's going on with that person. And so then we give them things to do. So it's not about drugs and surgery, which are helpful. There's a time and a place for all of these things. But once you get past the drugs and surgery, then what? Or what if you're not that bad yet? As I said, some people, they're not bad enough yet for drugs or surgery. So the protocol we use affects every cell, every tissue, every organ, every system simultaneously. It's a holistic treatment program that a person is responsible for. The doctor or practitioner can't really make these changes. It's up to people to behave themselves. And so it treats nothing specifically. We don't fractionate the body into a gastroenterologist for this and neurologist for that and endocrinologist for something else. It's look at all these healing opportunities and have the person follow some lifestyle and behavior requirements that would have that effect on every cell, tissue, organ, and system. So our saying is we don't treat anything specifically. We treat everything non-specifically. So it's really kind of the ultimate non-specific form of treatment. It works hand in hand. If you have a gunshot wound or a bone sticking out of the arm bleeding, you don't call your nutritionist for those problems. And so when it comes to pregnancy, which you mentioned, what we notice is exactly what you said, Dr. Quinn, that when a person has sort of given up, I remember a couple came in to me, and the lady had a bunch of different problems, and we were working all of that simultaneously with all of our labs and all of our protocols. And then all of a sudden she calls me up after a few months. She's driving home from her doctor with her husband and says, we're pregnant. And I thought, well, that's lovely. Why are you calling me? Because it was never on their list of complaints. And she goes, no, you don't understand. We gave up 9 years ago trying to have a baby. But all of a sudden, I'm so healthy and I'm so much healthier dealing with these other things she had going on. And we both looked at each other after the doctor gave us the great news and said it's Reed's fault.
Mhm.
Yeah, like, well, so she had just gotten healthy enough to be able to conceive, and now
Well,
was carrying a child. Yeah.
also the beautiful thing about what you said, and that I think is so important and people don't realize, is what you said in the beginning, is you're giving people the tools, so they have to make lifestyle and behavioral changes. And that is such a different mentality, and all of the difference in the world in people's health, of I can make the change versus like this thing is changing me, or you're going to change my life, or the doctor is going to change, or I have a disease. It's like, what can I do to fix and or heal or encourage my body to go in that direction? And I think when people really take responsibility. I mean, I tell people this all the time in my office, like, you have to be an active participant in your health, not passive, period.
Exactly.
If you're a passive participant, you're not, like, you're kind of in, you're not going to get better, but part of it's like the blame, like this, like health happens to me as opposed to I make health happen to myself. And that's all of the difference in the world and people, in my opinion.
You're right. You're absolutely right. It's not accidental. And
Correct.
so in our world where we are looking at lab work, again, not for diagnosing a disease, but just what are the healing opportunities? What's out of balance? What needs improvement? And then you can, describe or recommend a protocol of again, eating right and going to bed on time and exercising and reducing stress and all the ways that it could be hidden or obvious, and then supplementation and things. So you investigate and then you create a program. Well, someone has to run the program, and who gets to do that? That's where the patient or client has to be responsible and take ownership. And there's assistance through the health coaching procedure and stuff. But yeah, you can design programs all day long. If no one's running the program, where does that leave you?
You
Right.
know what I like about Reed's chapter? He actually talked about one website which I also used in the beginning of getting going to FDN. That's the customized plan for your diet, and because everybody is different, and that's the problem with a lot of programs there, because they don't look at these differences. They give you this diet plan whatever you are, like whatever problem you have, they don't check on it. They said, okay, for pregnancy, okay, eat this, and they don't know what's the problem with your body. Or are you a fast oxidizer, a slow oxidizer? Are you, the different types that we categorize in diet. So that's one part I love. And also your dress code, that talking about steps, how you can get better based on your customized plan.
Well, I recognized in the office right away uh, a lot of things. First of all, was that everybody was on a cycle of trial and error, and they're just trying things, and they would bounce around from one practitioner to the next, with never really getting satisfied. Some of that was due to the diagnosis and treatment, strict diagnosis and treatment mentality. There's nothing to diagnose, or with the diagnosis, you're only working on that one thing. And so that's part of the problem. The rest was that they were trying quackery, just anything. I mean, there's a bunch of people making a lot of money just selling one thing, a one size fits all approach. And, I couldn't go there. So I started noticing that it's what people did at home that mattered the most between their visits. So whereas not Dr. Quinn, of course, but as some physicians might just say, here's, I've diagnosed you, I ran that test, here's your diagnosis, you're hypothyroid, here's your medication, see you in 3 months. Well, we would look at, first of all, a number of healing opportunities and a whole complete lifestyle program. And then let's do this together for 3 months. So they're getting a whole different paradigm, and they're taking that responsibility. And it doesn't mean they might not have a medical condition in that mix, but we're there for the non-medical part of it. And Dr. Quinn's there for that and the medical part too, I
Yeah.
think.
Yeah, definitely.
So I just want to know the regenerative medicine. What's the purpose of regenerative medicine?
Well, so regenerative medicine is a huge category. I mean, and multifaceted. So specifically, I do a couple of, let's see, how do I simplify this? So there's regenerative orthopedics, there's regenerative aesthetics, and then there's like regenerative cardiology and things that I have no clue about. But then there's just kind of the overall umbrella of regenerative medicine. So the umbrella of regenerative medicine is to use the body's natural healing abilities and sometimes augment the natural healing abilities, but to use and augment to heal itself. And so whether you're doing that from aesthetics, orthopedics, cardiology, all the things, you are actually using your cells and your cellular components and how the physiology actually exists in the body to heal itself or to enhance itself. So that's kind of the overarching umbrella of it. And then there's many, there are medications you can do that. There's supplements that can do that. I believe in the book, I mean, I'm specifically speaking of using platelets and stem cells for mainly orthopedics and aesthetics. And but the purpose is to help the body heal itself or slow degeneration, which basically starts happening at about 25 years old for everybody. Wow. Approximately, like we peak around 25. I mean, that's not every bodily process in the body, but 80% of them peak around 25 and then start degenerating. And so it's either to slow the process of degeneration or to literally regenerate. So that's the purpose. Again, I started off in the orthopedic realm because I come from that specification, and being an athlete, that really speaks to me, like physical injury and how can you get back to doing the sport you love or living the life you love or picking up your grandkids without pain. And so that really spoke to me. And so from that regenerative medicine standpoint, outside of the supplements and the medications and things that people can do, we are either specifically taking your blood and centrifuging out the platelets, and the platelets are what I call the general contractors of an injury. So your joints and ligaments and tendons have a poor blood supply on their own, and your blood supply is the highway to health, right? So if your blood cannot get there, it cannot bring the healing cells to where they need to go. And so we have what's called watershed areas where there's blood flow from here and blood flow from here, but like this middle part is your joint, and there's just not a lot of good blood flow. So even if you injure it on your own, you cannot bleed in high enough quantities to get the cells that we're putting in, nor are you actually bleeding into that area to heal it at all. So there might be some like trickle over effect and there's some healing, but there's really not a significant amount of healing. And as we get older, our blood flow is less significant and less robust, which is why we heal more slowly. And so with regenerative medicine and taking your platelets, we're taking a huge quantity of blood, concentrating it down to maybe like the size of your finger on average, depending on the area we're treating, and putting that into an area of injury. So not only are we putting a supratherapeutic dose of cells that wouldn't happen on its own, we're also essentially forcing a blood supply to an area that doesn't have one on its own naturally. And then the platelets in there are why I call them the general contractors, is they're calling in their buddies like their growth factors and cytokines and stem cells circulating in the system to come heal the area. Stem cells are what I call the worker bees. And so when we take stem cells, and I highly recommend using your own stem cells, we are taking your stem cells in your bone marrow, which is from the back of your hip, and we're doing a mini liposuction to get some fat, depending on the condition, and then concentrating it down and injecting that back into the area. And so, but with the stem cells being the worker bees, I mean, now, we are essentially taking millions of workers and putting them in to actually do the work. So platelets are great, and they're great and often suffice for a lot of injuries, but sometimes in things like severe arthritis, labral tears, I don't personally think platelets are doing the job well enough. And so you got to bring in the workers. You can't just stand there with a megaphone. So that's kind of how I think of the different, there's also prolotherapy and things like that, but essentially that's what we're doing with orthopedic regenerative medicine.
We are actually number one hot new release in orthopedic, and because that's a great chapter. I love what you wrote there, and I work with all of these authors, and we just try to simplify the concept to be understandable for the public, and that's the beauty of this book, because it's so boring, to be honest, to get the medical book because we don't understand it.
I love that stuff.
I thought you did a great job, Jordana, on the explanation. And just from a personal experience side, I said I've got this well-used body that includes surfing and skiing and football and motorcycle injuries all around, both knees, both shoulders, neck, back, low spine. And I went from prolotherapy to then the platelet-rich plasma, the PRP, and then to stem cells where they did take them out of my iliac crest there, and
Yeah.
didn't feel great, but it had some really good benefits. I feel like I can exercise more now. And so that's how it fits in perfectly with our entire philosophy of, you know, um, you got to behave yourself. But if you've got this damage, things you did, you can't go back in time and change. So now you've got to deal with it. So along with those advanced, and by the way, I use a DO. Dr. Darrington's a DO orthopedist. He says I
Dr.
treat
Who?
at Dr. Darrington. He's in Oceanside, California,
Okay.
and he does what you do, and I just love it. You explained it so well, very easy to understand. And if you're doing that, but you're also doing the lifestyle, you're eating a clean, non-inflammatory diet, and you've tested to see what's problems are there. Pantea mentioned the diet that we use, and you're also resting and letting the body recuperate, regenerate. You're exercising to make sure blood's flowing and cardiopulmonary and the whole thing. And then stress reduction. Well, pain is a stressor.
Oh
And
man,
so,
pain is the biggest, stress is the biggest pain generator. I mean, I would love to have like an entire hour-long conversation with you
yeah,
about stress and pain, or just stress. I mean, stress is literally, I'm coming out with a course here in a few months on optimal
fantastic.
performance. And the number one, there's pillars of health, and the number one is stress reduction. And because we can't quantify it, right? I mean, we know we can measure someone's blood pressure, which is a pretty good indicator of stress. But I don't know. Anyway, sorry.
Well, pain's right up there among all the stressors. So
Yes.
you would love it, and we will have that conversation. I have a whole group of practitioners, over 500 active practitioners, and you could come and speak to the group, and we do a thing on pain management, and how much of a stressor that is, because your body responds to it with the cortisol, and the DHEA goes down, and it throws your sex hormones off, and you're miserable.
Miserable. And stress causes pain. So when people are under stress, they feel their pain more. So it's a catch-22. And I really like something you said. I mean, first of all, I always argue with my patients who are like, oh, I shouldn't have played the sport or whatever. And I'm always like, all of my patients who are athletes are better off than the people who have internal diseases because they were sedentary. So I always argue you might have some pain, but you don't have diabetes and high blood pressure, whatever, in my mind, that I consider more difficult to treat and to change your lifestyle, right? Because if you've had a healthy, active lifestyle, maybe your diet's not the best or whatever, but I have found easier to convince people 50-50, change their diet. People who are used to being athletic and feel good know what it's like. But the other thing, I mean, is truly you cannot separate, and we do, and I still do. If someone comes in with an arthritic knee and stem cells is appropriate, we just give them stem cells. I mean, some of my professional athletes could care less about me talking to them about diet, and I obviously can't talk to them about exercise because they're exercising more before they wake up in the morning than I do all week. But they're
over exercising.
Well, right. And I mean, they're getting paid to do it, right? I mean, literally the professional athletes it is their job. But right. So if someone just comes to me with an arthritic knee, I'm probably just doing stem cells. But if they're overweight and have other health issues, I mean, I'm talking to them like as part of my stem cell package, I'm offering them, I pay for their physical therapy because that's how important it is to me for them to get better. But we talk about weight loss. We talk about their diet. I mean, because if you're non-sedentary, I mean, just like what you said, it's not one without the other. It's just
Exactly.
it can't be. I could put all of the stem cells in your knee, that you want every single year. But if you're 300 pounds, you are going to degenerate at a rate higher than I could shove stem cells in there.
Exactly.
Yeah, great point.
We had some comments. People are watching us.
Nice.
And some also some authors who couldn't attend this. They said, we are so excited to be part of this book, and hello there, co-authors. Just want to say that we are. If you have any comments about functional medicine or about regenerative medicine, please leave us comments. We are here, and you can join us and ask your questions. All right. The second thing we're gonna do is about the collaboration with this book. And what is your feeling to be the best-selling author? Because right now, congratulate you, because you are number one bestseller in three categories in US. And I just want to know what's your feeling. Starting with you, Reed.
I feel fantastic, and as part of the work, part of the journey, and I take a lot of things in stride. I'm pretty parasympathetic dominant. I'm the guy that doesn't scare easily. So I'm proud. I'm a little nonchalant. I'm humbled, but also I have to say that my wife became a best-selling author this week in another category. So
Congrats, that's awesome.
Yeah, that's
yeah,
great.
yeah, she worked really hard and very excited. She's doing more of the work herself than I had to do, because I have a team, and of course you've been a great leader, Pantea. But I couldn't be prouder.
Thank you so much. And what about you, Jordana?
Yeah, I'm a bit of a slow responder in general. I'm actually always in sympathetic overdrive. I should take my own advice, but in general, I mean, I think it's cool. I think I need people I know to read it and tell me that it was good or not. And I need to hear like honest feedback from people. But I mean, I think the message is very important. And so the more people that read it, the better, that's, more than being like a bestseller, which is important, and having these titles. I think changing the world of medicine is is the most important to me, and impacting people's health. I mean, that sounds cheesy, but
It
it's
sounds
really,
wonderful.
it's what
Yeah,
I, it's what I love.
I agree with you completely. It's getting the message out there. We've been getting the message out uh, for I've been teaching since 2008. It's the same message. It's just different ways of getting out there. So I'm very thankful to have this
Yes.
opportunity. Yeah, and
Yes.
Thank you.
Dr. Quinn, I know was saying the same thing, that you know keep speaking your truth.
Yeah.
Right, and hoping people hear it. And this was Pantea, thank you. It's such a wonderful way or platform. I mean, um, I mean, I've considered writing a book, I've considered jumping off planes, I've considered doing a lot of things in my life. I've jumped out of a plane, that was fun. And but when are you going to have the time to do it, right? I mean, for me, I
Exactly.
still have young kids. I have I mean, I own my own practice.
Very busy. You are so busy, I see.
Right. So you were the inspiration and the force behind me. Just okay. Oh, I could write a chapter and collaborate with others. How amazing is that? Because to me, the thought of writing a book, I never would have given myself the time or space to do. But it is so to collaborate with other authors that you can share your message and your dream is amazing. And so that people have the opportunity to read the whole book is really special. And like Reed said, just getting the word out there and having honestly like bigger impact. I mean,
Exactly.
we can change the world of medicine.
So because I'm telling you why I'm so inspired to write these books, because I had lots of problem with my fertility, and when I had my baby in my arms, I said that's my mission. I have to do it.
Mhm.
I was a software engineer, project manager. I was not into like writing another book or doing like healthcare stuff, or I had no idea about the anatomy, I had no idea about the labs, but that was my world right now, and I'm so proud of it because of you. You taught me a lot of things during this journey, and all of you were a lot of great. I mean, gave me a lot of inspiration to do what I'm doing right now. And the point is, see, why I didn't hear about the functional medicine before, why I didn't hear about the regenerative medicine before, because these are not uh, topics that public go through it, and they go through their pain. Unfortunately, they take medication, and they just want to have temporary relief, and that's not good. And
Right.
that's my message. Just try to bring all these modalities for others to choose from.
Yeah, I think getting relief is important, not to be overlooked. We would rather work on the long term underlying conditions and things, but relief is okay. You to get out of pain is not a bad thing. How you do it matters, but whatever the symptom might be, we don't poo-poo relief care, but
But
we just
sometimes
say
you need to
don't.
start with the relief to
Yeah,
then
don't
make the
stop there.
long-term
Yeah,
changes, right?
Yeah,
yeah,
long
just don't
term.
Because if
don't
you're stuck
stop
in
there.
misery, you can't focus on 10 years from now or even a year from now. You gotta,
Yeah, I mean, if a woman comes to us with hot flashes, we don't say, well, we're going to take 6 months to balance your hormones
right?
and they'll go away. No, you have to get rid of them now, but then you still do the same program over that whatever the time period is to get to the underlying imbalances and things. So
Yes,
relief's okay. Correction is much more important.
for sure.
Because you cannot use pills forever. Like I'm saying about the asthma, I had asthma, and puff. The first time I heard that I have asthma, I didn't believe it because I didn't have it for a long, long time. I didn't have this problem, and then when I go to doctor, they say use this puff forever, and that's so sad. I couldn't change it with that, uh, like a style with that method. I had to find something new. So that's the reason we are doing this, because you don't need to take medication if you really don't need it. You know what I mean? Because there are lots of healing opportunities. You find the problem inside. Maybe Reed has a really great example about the thyroid. I love that example. If you yeah, let's say with the thyroid is so tricky, someone come to you as with a thyroid problem, and then you go to other uh, parts and you see that's not the issue, that's not the real issue. Do you remember that example?
Oh yeah, sure, that and many, many others. So, you know, again, relief care is important. And you might show up to a doctor's office with the symptoms, the sort of classic symptoms of hypothyroidism. And the physician would test the thyroid and say, yes, I found your problem. It's hypothyroid. And here's your prescription. And let's titrate it as we go forward to get the. What they start doing is kind of treating the paper from our point of view, just getting the numbers right, and that becomes the focus of the visits to the physician. Are the numbers right? Whereas your complaints might fall to the wayside. Like, yeah, you abate some symptoms, may abate a little more energy, lose a couple pounds or something, but really all the underlying things, that the rest of what you need to work on is practically being ignored. And so we really just take a comprehensive approach, and it help, thyroid, which is your master of metabolism, often heals itself. Like Dr. Quinn said, the innate healing ability of the body needs to be at least acknowledged, and then moreover for us, that's our main focus is coaching up function. You don't have to teach any cells what their job is. They know what their job is. There is an innate wisdom, intelligence, or strategy. It's a metabolic reserve, and so we coach that up while we coach down the contributors to metabolic chaos, I call them. It's all in the book, folks.
And
Yeah, read the
there,
book.
and there really are. I mean, I'm a physician, so I feel I would be remiss if I didn't say there are real diseases in the world that people need to take medications for, or real things.
Definitely.
I don't yet believe. Maybe I will here with some of the mental work I've been doing, but I don't yet believe that 100% of the things can be cured. Or, there are children that are born with terrible metabolic diseases and don't
Exactly.
produce enzymes and don't produce. So it's not that we're saying that there aren't, but there's so many diseases of aging that we just accept as part of aging that you don't have to accept. And that's, so I just want to kind of make a difference. There's specific things that we can change with diet and exercise and mindset that make a huge impact on your health, that people just don't realize or know or believe. And and that's
Yeah.
really where we should be starting, that's really where we should be starting in medicine in general. It's hard, but I mean, it's hard as a physician because I actually found this literally this week, a patient who's super high level athlete, has some abdominal pain and things that go with it, and he's been to all of the specialists and like nothing's wrong, or they found some obscure things, and so we've talked about diet and put him on some supplements. Nobody has addressed his mindset though and his mental health, and he doesn't, and I actually tried to address it with him. He doesn't think he has any problems, but he's a veteran. He's had a lot of he's in the skiing world and has had a lot of his like coworkers and friends die, and so I am as 100% sure as I can be that a lot of his present symptoms are due to, but nobody's addressed it up here. And he's not even ready to address it, in all fairness, because I went there with him. And so it is this balancing act as a physician and as patients of, you want people to get better. But not all patients are also ready to accept the challenge of
Exactly.
getting better.
Exactly.
I
Sorry, who is watching us? I'm so amazed, Jordana.
That's my
Usually
mom.
we're on Facebook. I love you, Mom.
I'm amazed that my mom's on as well.
hey, where's my mom? Mom, are you there? At least my mother could have showed up. Geez.
Yeah.
So, no, I really get you. I love what you just said. And, there's medical, and there's a lot of people would include us in the term complementary, but really we're just non-medical. So there's medical, which you might need, and they're there to save your life and stop the progression of any downward spiral that's really contracted. And yet, because then if the downward spiral is really contracted, observations I might make can't really be capitalized on. You've got to get out of the woods first. Then the observations I make about hormone imbalance or gut dysfunctions, then we could really capitalize on those observations. So, but one is medical and one is non-medical.
I call it common sense medicine, but we're so far removed definitely in America, and I'm sure in other countries as well, like we're so far removed from health, like just it starts even outside of, we shove food in our mouths and we eat processed food, and then we run to the next thing, and then we're stressed, and then we live in boxes, and then we never are in touch with nature. I'm totally touching on like all of these things, but it really is like the bigger picture of what brings us health is diet, and is exercise, and is sleep, and stress is a big one, but it's joy and a sense of belonging to humans, and we're all in our own. All of these things are so important and impactful on our physiologic health, but we separate them, and that's unfortunate.
Yeah, let's all dance around the fire naked.
Yeah.
Kidding, of course, folks, but I think Dr. Quinn's making a really good point that it takes the entire environment. So you have your genetics, like you mentioned the kids with really bad, they're just born broken.
Yeah, it's terrible.
And they need intervention right away to save them. As they get older, who knows what might happen? They may latch onto a natural way of life that works for them, but they may also always have that vital void. We call those vital voids. So what we're in a process, we're in a business of kind of sorting out the chaos, uncovering dysfunction or imbalances and things. And as those get restored through natural strategies, you may indeed uncover some vital void that's not going to change from supplementation or exercise or diet or anything, in which case you'd have to deal with it. Then it might be a medical solution or something you just have to take for the rest of your life. An example comes to mind. Oh, you're missing your gallbladder. Well, you forgot to tell us that. And that's a vital void, especially with regard to digesting fat, and these things. So there are vital voids that where you have this nice combination of, again, medical and non-medical.
Yeah.
I think it's a perfect, there's a lot of harmony available there.
Yeah.
So this book is available on Amazon. Please go and take it. And
go buy 10 copies.
Yeah, 10 copies, why not? But right now it's ebook. And we're going to have the print version soon in a summit. We're going to have a bigger summit with other authors and other participants, because this mission is so important for me. I really wish people live pain free, and maybe not for all of them, but at least we can help a lot of people. And this book is so simple to read. And I just need you to give me one sentence of hope. If somebody come to you with a lot of diseases and very disappointed, what do you tell them? So we start with Reed.
See, I'll have to say that we need to learn to get control over our health and not give it up to anyone else. It's your birthright to be very healthy, and you've got to be aware of that and take that sense of responsibility.
Yeah, I mean, mine is the same. Be an active participant in your health. You're not guaranteed health. So I actually a little bit of the opposite. I don't think it's your birth. It is your birthright, but I don't think you're guaranteed it or given it. So you must be an active participant in your health, as if it's your job.
Yeah, I like it. And I like the collaboration between the medical doctors or health practitioners with patients, because not is not happening for everyone. Because I had a lot of examples for myself and my side. I was really disappointed for my fertility treatment because my doctor always gave me a lot of statistics. That's it. And she was very disappointed from the beginning. She said, "Your age, or you have problem. You are diagnosed with unexplained infertility." So these kind of problems and this kind of uh, mm, explanation is not going to help your patient, right? So that's my purpose, to just see how collaborative patients and medical doctors or healthcare practitioners can be together. You need to fight for your health. You need to do all the work, and it's not only your doctor give you medication is not enough. You have to work on yourself to get better.
Mm-hmm.
Yes. All right. Thank you so much, guys, for watching us. Hopefully, you can enjoy this book and enjoy uh, being healthy and pain free.
Fantastic. Thank you.
Thank
Thank
you.
you so much.